Yeah, it came up a few. What's going
Hey,
on?
yeah, yeah, we good?
Yeah, I think we should. Let me make sure we good. Make sure we good.
Because the thing I don't see is I don't see if other folks are able to see it.
Okay, yeah, I look like they coming in.
Okay, I can't. So it's a different kind of look, man. I'm so sorry about this.
Oh
I think
no, no, hey, this is like luxury for us for the community. I'm glad it's like people chiming in now. They chiming in. Everybody chiming in. We on the chat room.
okay.
Everybody chiming.
So you can see the chat room, okay?
Yeah, I
Because
see.
I can't see the chat room. I can see the okay. I can see the. All right, let me see. Okay, all right. Yeah, I can see that now. So man, all right. It was the devil.
That's what it was. They don't want to get the information. We don't want the information to get put out. So
Hey,
hey,
that's right. That's right. We probably gonna change somebody's life tonight. So hey,
yeah, that's what we expecting to do. So I don't want to keep it delayed. I know you're a busy man. I know you're probably tired, exhausted, but you're keeping the community going. You're keeping us going. You're helping out in the community. You're doing a lot, my brother. You're doing a lot. I say my friend, brother. Y'all don't know. This is my classmate. This is my
right.
friend, brother. The smartest man I probably know on this side of the earth. But,
Man, you
hey,
have met more folks now, so that's probably gonna have to change.
yeah, yeah, hey, hey, it's all love, it's all love. But I want to welcome you to those who are
You hear that feedback? You know what? I think I know what the problem is. I think the problem is all right.
you got it.
Yep, I think so.
Yeah, we good. Now. You got people chiming in, so everybody coming in. So want to welcome everybody back to another episode of Those Road Talk. Hey, ladies and gentlemen, tonight we got the to have on here with us tonight. We honored and blessed to have Dr. Vernon Rayford on here with us tonight. We want to get him on tonight for the community, especially the community of Holly Springs, Marshall County, surrounding areas, to talk about this pandemic that we're going through. It's the uproar pandemic. It's steadily clamming. So we want to get him on here tonight to talk to us about this pandemic. He's well experienced in it. He's a well-known doctor in our community. So we just want to get him on here tonight to speak a little bit about this pandemic and the COVID-19. Well, Dr. Rayford, we're glad to have you on tonight. We're glad to get you on and talk to the community where you're from about this pandemic, about COVID, and
Yeah.
how's it going. First of all, I want to say, Dr. Rayford, can you just start out a brief moment, just tell us a little bit about yourself, you and your family, basically.
Yeah, yeah. So I mean, if you if you're on this, you probably already know me. Um, this is this me? You still get that feedback, aren't you?
Yeah, I just cancel it out. It's good.
Okay. Yeah. So I'm Vernon Rayford. I'm from Holly Springs, raised in Holly Springs. Family still there. Um, 1999 graduate of Holly Springs High School. Went to Ole Miss for pharmacy school, Vanderbilt for medical school, and then I did my training in Boston at Harvard and Massachusetts General Hospital. And I've been in Tupelo for 8 years now. Trained in internal medicine and in pediatrics. I see mostly adults, and for the last 18 months, we've been dealing with COVID, and different aspects of COVID, but dealing with COVID nonetheless. We've learned a lot. We've seen COVID do a lot of bad things in the community, and I'm excited to be talking to my hometown community because you guys are my folks, my people in Holly Springs, and so making sure that y'all are able to get through this pandemic with as little little loss of life, a little loss, with as little, unreversible health damage as possible. So, I also don't want to really lecture you guys, but just kind of answer the questions about, what's on your mind about COVID? What have you heard, or what are you concerned about? You know, how can you protect yourself? So just kind of feel free to ask me those questions. And but I'm just excited to be here. So this is home for me. This is home for me. Y'all knew me as Vernon, so Vernon is back home to just talk about, COVID. I'm just blessed to have the training and the experience the training and experience to kind of be able to, help provide some good information for you.
Oh, okay, yeah. Hey, I was glad and honored when you say you would come back and just do it with me, do the interview. I'm elated. I'm proud of you. I'm glad of what you do. I'm proud of what you're doing in the community, not just our community, but worldwide, to help to try to make the numbers go down with COVID. But I want to ask you this, well, like you just said, the people, Hot Spring, the people might not know, me and you are classmates. We graduated from the class of '99. You was a valedictorian. I think you set the record for the highest ACT score at that time. And y'all don't know about it. We set the record for, I wasn't part of that one right there. They set the record. We had the most honor students in our class in history. We started that trend. But I know you just told us, you basically touched on your educational background within the medical field. Well, Dr. Rayford, as you know, we are in an unprecedented time in the world, a pandemic. Would you agree that this is just this is history that's being made in the medical field and just in the world for us, this pandemic?
Yeah. So we are in a once in a many generation worldwide pandemic. These don't come around often. So the last similar pandemic was over 100 years ago. So we were blessed. I believe that we were born in this time for a reason, and this is a once in a many lifetime kind of pandemic. So, that's COVID. I know there's some people trying hard to dismiss the impact of COVID, but this is COVID. So this is a once in a lifetime kind of, once in a many lifetime. Folks, a couple of generations before us didn't deal with COVID, and the closest thing that we have was um, the worldwide pandemic. So the pandemic flu of the late 1919s into the early 1920s. And so we are, it's just worth recognizing. We also have better tools and things now than they had 100 years ago. And the big tragedy is, despite the best tools and the knowledge that we have, the tragedy is that people are still not taking advantage of all that they can take advantage of.
Okay. So I know I see you post a lot. I seen earlier you post something with the France about the pandemic earlier today. And I pay attention. I try to pay attention to a lot of stuff. It's something I've never seen before. A lot of us haven't never seen before. But based on your experience in the medical field, can you tell us what is COVID-19? What basically is COVID-19?
Yeah, that's a good question.
So COVID-19 is the disease that is caused by the SARS-CoV-2 virus. So SARS-CoV-2 is a virus. So viruses are infectious agents that contain genetic material and other things like proteins that help it infect cells. What they do is they get into the cell and they take over. So they don't bring a lot of the machinery to reproduce. They get into our own cells, take over that stuff, and then make our own cells reproduce viruses so that it can spread. It's a type of coronavirus. Coronaviruses are known. Some coronaviruses cause the common cold, but there's some coronaviruses like the first SARS-CoV-1 that caused the first SARS. So it can range from just kind of mild cold symptoms to the severe COVID-19. So the 19 is the name of the disease. So when you have the cough, shortness of breath, fever, sore throat, and you test positive for the SARS-CoV-2 virus, then you have what we call COVID-19. COVID-19 is the disease or the symptoms caused by the SARS-CoV-2 virus.
Oh, okay. So that, to be honest, this is like my first time just somebody just breaking it down into what is COVID-19 per se. I know everybody talk about the symptoms and all of that, what you could have to have COVID, but
Yeah.
just breaking it down to cells and all that type of stuff. This is the first time I ever heard somebody just break it down into their knowledge for us. So let me ask you this. So I know for the flu, it kind of have the symptoms of the flu too also. So what is the difference between COVID-19 and the flu?
Yeah, man, we spent a year and a half trying to prove that COVID wasn't a mild flu. So difference is they are caused by the flu family of viruses is a different kind of virus. The SARS-CoV coronaviruses are a different family. How they spread is different. And then what's more important is the just kind of how new the virus is to humans. So the SARS-CoV-2 virus was very new, which meant that it had a whole lot of potential people. So 7+ billion people that it could potentially infect. We've had different versions of flu around for years and years, and we give flu shots every year. So the kind of the potential to cause large disease outbreaks and a large, population of sick folks and a large amount of death, the SARS-CoV-2 virus had a huge potential because it was relatively new. And what that means is it just wasn't circulating with all the rest of the viruses that could cause us. And where we think it comes from is there are some viruses, and the flu can do it, that can live in another species, pig or a bat. And what can happen is they can live in species that are close to humans and can kind of evolve to where they can start infecting humans. And that's what we think happened with the SARS-CoV-2 virus, is that it evolved in another species, and we think it was a bat species in China, and it developed the ability to infect humans. And so you end up with a new kid on the block, which was the SARS-CoV-2, and it was largely unknown. So our immune systems didn't have much of a sense of this, and so you get this rampant spread that we have, and eventually we're going to get to the end of this, and it's going to become just another common cause of the cold, but we'll need a whole lot of immunity. So that'll be from vaccines and infections together, so that it can go from this pandemic virus to the everyday, oh, he got COVID-19, it's just a cold now. We're not there yet. It's still a pretty big deal, just because we still have a huge portion of the population that don't have any immunity to it.
So with that being said, I keep you saying, the key word to me is the immune system.
Yeah.
So
Yep.
So let me ask you this. So with you getting the vaccine, is that a immune booster? Would you say that's an immune booster, or which I don't too much talk about. I take the vaccine, but I work out too also.
Yeah.
I exercise. I try to do my part, take my vitamins, and do all that, and push stuff into my system to build my immune system up and keep it up. I think my immune system is up, but I try to keep it up. So would you say taking the vaccine, I'm getting to the meat of it now. I want to get into the meat of it. So taking the vaccine, let people know, does it stop you from getting the COVID?
No. So I kind of want to go back to, what do we think in medical community? What makes a good vaccine? And so when I think about what I want in a vaccine, so whatever the next infectious virus that comes out, or bacteria, and there's a potential for a vaccine, I want a vaccine to do three things. And the first two are so important that I'm willing to accept that it don't do no very well. So I want a vaccine to keep people alive. So I want a vaccine that keep people from dying from whatever the infection is. I want a vaccine that keeps people from having severe infection. So a vaccine that keeps people out of the hospital, out of the emergency rooms. And then ultimately, I want a vaccine that decreases the risk of infection altogether. And what we have with the COVID vaccines, Pfizer, Moderna, and Johnson & Johnson, all three of those vaccines do 1 and 2 really well. If you are vaccinated, your risk of dying from COVID is much, much lower, is significantly lower. If you are vaccinated, your risk of needing to be in the hospital is significantly lower. And what we're learning is that even though some vaccinated people can catch COVID, the COVID that they're having is a different COVID than if they caught it in December or November. And so they have a lower chance of dying. And over this pandemic, it has been fairly predictable that typically about 8-9% of cases. So every time you hear the cases reported, so say they report 10,000 cases, we expect 8 to 9% of those people to need to be in the hospital in the next 2 weeks. And in Mississippi, about 2% of those cases are going to die. And so if you want to use nice round numbers, so for every 100 cases reported, we expect 8 to 9 of those people to need to be in the hospital in about 2 weeks. And we expect 2 to 3 of those people to die. And so when that number is 5,000, you can see why we're so concerned about COVID. And, we're concerned about COVID is that out of that 5,000, 8 to 9% is a big number. And then 2% of 5,000 is a big number. We know that with the vaccine, we can really put our thumb on the scale in favor of keeping people alive and in favor of keeping people out of the hospital. And so I strongly push the vaccines, not that it can be the difference between getting infected and not getting infected, but it is shown that it can be the difference between getting infected and dying and getting infected and living. And so the vaccine is a specific way that we can train your immune system to recognize COVID so that if it's exposed to it again, it can already be ready. And so general things like healthy eating and exercise, those are good things for your immune system in general. But the vaccine is an immune agent in specific. So the vaccine is saying, I'm going to help you target SARS-CoV-2 virus.
Oh, wow. Okay. Okay. So what you like, the war to me is like the war now is like, I'm back. I hear a lot of people say, but they always say, well, you got the vaccine, you still can get COVID, which is what you said. Yeah, you can still get it, but it's better to have the vaccine to help fight the other stuff that come with it.
It can help save your life. So just as we know that people who we offer flu shots all the time, we offer pneumonia shots all the time, and we know and understand that you can still catch the flu or you can still catch that bacterial pneumonia having had those vaccines. But we have a lot of experience with those, knowing that it's the difference between burying that person or having that person in the hospital for weeks and weeks on end being really, really sick. And so the idea behind the vaccine, and we've evolved, and I think back to what the message in healthcare, we're learning about COVID just as other people are, and if I could go back, I think I would go back and tell myself, be careful about the message that we're giving people. I think at some point the message that we gave, because, we had a COVID variant that we thought we understood. We thought the worst thing that could happen to us in the United States was the Alpha variant. And so that variant was one that had been spreading in Europe and had become the dominant strain over the summertime, but that variant was well covered by the vaccine. Little did we know that there was going to be a Delta variant that was going to be more contagious, and a Delta variant that was going to be able to spread so fast, particularly to those who weren't vaccinated. And the Delta variant is so significant that if it does cause an infection, that the amount of virus that you can find in the nose of people who are infected, that's a lot. And so a vaccinated person who only have mild symptoms may still be able to spread that virus to 5 or 6 other people. And that's why we had to go back and say, okay, guys, we need to go back to wearing a mask, even if you're vaccinated. Previously, we were saying, get a vaccine so you don't have to wear a mask. I don't think, I would not do that again. I don't think that helped. I think a lot of people heard that and think that the vaccines don't work. We in healthcare, these vaccines are doing exceptionally well, because the people who were predominantly dying last year, people in nursing homes, older folks, if they're vaccinated, we're not seeing that as much. And so we're seeing nursing homes that, that instead of losing, 2/3 or a third of the people who live there due to COVID, we're seeing them survive. And so we know that it's helping, because it's protecting the most vulnerable folks from dying from COVID, even if they're catching the infection still. And even though it doesn't reduce your risk 100% of catching the virus, there's still a many-fold reduction in your risk of catching it. And I'll just kind of put myself on the thing. I see people with COVID. I'm sitting across the room in a small room real close to them, wearing my mask and wearing the vaccine, have helped me largely stay COVID free.
Wow. So I think the majority of people, I think they get the misconception of what the vaccine is intended for, because the mass majority said, why take it knowing that I can possibly get the vaccine, get the virus also. So why take it? And I don't know. So could you tell us what is in the vaccine? Are you able to tell us what's in the vaccine?
Yeah. I mean, that comes up a lot. So there's 3 vaccines, and the 2 vaccines that we use a lot, Pfizer and Moderna, and they use a technology called messenger RNA technology. And so I'm going to get a little bit in the weeds, and forgive me for it. But in our body, our DNA is the blueprint. It's the blueprint that tells us where to put the stuff, where to put the proteins, when the protein is supposed to be recycled. So in any way, for our DNA to kind of go from DNA to protein, they use intermediaries. RNA is the intermediary. It's the intermediary thing that can connect DNA to protein, so that what happens is, inside of a cell, the DNA is read, messenger RNA is created inside of our cells, and then that messenger RNA is then sent to another part of the cell so that it can make the proteins that we need for our cells to function. So what we've learned is, what you can actually do is you can give a messenger RNA code, and that code is for what we call the S protein. That's a protein that's on the surface of the coronavirus, and it's one that's responsible for it attaching to cells. So we are using messenger RNA in a different order. So we're given a messenger RNA code, and when it's injected into our cells, it doesn't go into the place where the DNA is. It stays in that compartment where the proteins are made. And so that messenger RNA code is made into the protein. That protein is on the outside of the cell, and then that's when our immune system recognizes it. Our immune system will now see all these cells with that protein on it and say, this is abnormal. I need to remember it, and I need to make preparations in case I see it again. And that's how the messenger RNA technology in the Pfizer and Moderna goes into the cell, creates the protein, and then get the immune system to see that protein and then generate a response so that it can be ready. Now, the Johnson & Johnson is a different type of way of delivering the information. So we do this with other viruses and other vaccines. So Johnson & Johnson, what they did was they took a virus that we know about, adenovirus, and they modified it so that it couldn't cause infection. All they could do all the viral envelope could do was carry the message. And so the Johnson & Johnson message is in a viral envelope, and then it's put into the cell. And the same thing that happens with Pfizer and Moderna is that that cell creates the protein's on the outside of that cell. The immune system recognizes that, and it's ready for it when it sees it again. So messenger RNA is a technology that's been around for 30 plus years. COVID is the first vaccine that we were able to make work with messenger RNA technology. And that's just, our blessing, our miracle, in that we were able to already have the platform, so already have the technology, and all the companies had to do was get the code in and make sure that it was pretty stable. And the other good part about messenger RNA, for some people who are worried about it lingering a long time, our cells have so many processes that just chew up the messenger RNA, so it's not lingering anymore. Just as a natural, just kind of thing that's out there for other messenger RNA is that there's so many proteins in there that break it down. And so the challenge with the vaccines was really how you could keep the messenger RNA stable until it can have an effect in the cell before the other cell machinery chewed it up. So I'm sorry I was a little bit in the weeds. So you asked what was in the vaccines. So for Pfizer and Moderna, and I'm going to make it simple, it's the messenger RNA. So that's the code. It's in a little fat droplet. And then there's stuff like salt, sugar. There's not many preservatives in the Pfizer and the Moderna vaccine. And so little salt, a little sugar, a little water, in addition to that little fat droplet. And those are the ingredients. That there are less ingredients in the Pfizer and the Moderna vaccine than there are in some of the other vaccines that we take, we take regularly. That's not to say that all those ingredients and the other stuff make them bad. It's just simple what's in the Pfizer and Moderna. Now Johnson & Johnson has a little more to it because it's a different kind of way, but the ingredient list reads a whole lot shorter than probably, if you go to Walmart and you pick up something off the shelf that you can eat, you'll probably read more ingredients in that food than you would for the vaccines.
So I've heard this come before, and people say, I don't know what's in it. So you actually saying stuff off the shelf carry more ingredients than the vaccine would carry. So stuff you probably, I'm just talking off the word. So stuff you buy off the shelf, that's more you put in your system than the vaccine is actually putting in your system.
Yeah, if you want to get down to it,
yeah,
if you really look at what we eat, then I'll tell you that when folks in their mind want to generate reasons to not do something, that reason about it only extends to the thing they don't want to do. You know what I'm saying? So, there's a lot of folks that buy weed, smoke weed. You trust your local drug dealer. You know what I'm saying? Nobody know what's in the, it depends on where you get it from. And so there's a lot of folks who don't want the virus, but are willing to smoke anybody's marijuana. And so smoke anybody's marijuana, eat anybody's food. And so it's probably not a great logical kind of thing to it that, that whole what's in it argument is usually used when you don't want to do something, and it's never used when you want to do something. It's never used, when you want to do something like, but this comes from my drug dealer, my Burger King drug dealer. So, those kind of things that come up, it's kind of funny, but the reality is, it's actually, simpler from our standpoint that, the ingredient list is that small. And so from a really what's in it kind of thing, there's actually no preservatives in the Pfizer and Moderna. The things that's in it, there's not preservatives and stuff like that have been with other vaccines, and people have worried about the preservatives and things. And there's no reason to worry about those preservatives, but those things aren't even in the vaccine.
Oh, wow. Okay, I'm going to ask you this right here, but it seems like things are not getting better. do you feel like is this the reason because more kids are getting infected? So I was speaking with one of our classmate Jeremy. Me and him was speaking the other day.
Mm-hmm.
So when the COVID first came out, it was said that it wouldn't affect the kids. So
Mm-hmm.
now it's running rapidly through the kids every day with them back in school setting and everything. So are those numbers increasing because of the kids, or this Delta virus just that is tackling so it's so vicious now?
It's probably a little bit of both plus some other stuff, but the Delta variant is different. The previous versions didn't seem to affect kids as much. Kids were not a big place where transmission could happen. And so, unlike other viruses, so the flu, during flu season, kids are a huge part of how flu transmits from schools to homes and things like that. What we found with COVID was that it was different. And it may be, one reason was that the exact place, so the exact place in the bodies that COVID attaches to is a particular kind of enzyme that certain blood pressure medicines affect. And so one thought was that kids had less of those receptors. And so we thought the kid had less of those receptors, so that infants and really young kids really didn't have, even if they tested positive, it didn't look like they were getting sick compared to older kids. Now with this Delta variant, it's more contagious and it's hitting kids. And another thing is that, yes, kids are back together in school. You have many schools that masking is optional. And so in many of the things, school is kind of back to normal. Last year, we were able to get kids back to school, but it was done in a certain way. There was distance built in. Kids were eating in the cafeteria. Buses weren't running at full capacity. There were alternative hours. There was extra cleaning on those alternative hours. And then there was universal masking, at least for those who could. I mean, I'm just going to say it, private schools, many of the private schools didn't have to do it. And so many in other places didn't do it. But what we have here is just this perfect storm. So we have a very contagious version of COVID. We have people who are sick of the mitigation strategies, folks sick of wearing masks, folks sick of distance, folks just kind of, just outright hostile if they're not sick of it. And then you have a portion of the population that's protected. And so you have now big portion of the adult population protected from the virus. So the virus is going to go somewhere. And what we're seeing is the virus is hitting kids. Now, what we do not know right now, and it may be something that we'll learn in the next few months, is whether or not the Delta variant is causing more severe disease. We know it's more contagious, but we don't yet know if it's causing more severe disease, which means are people getting sicker from the Delta variant than you would expect from the other variants? We know more people are going to catch it, and we know more people are going to spread it, but it's yet to be determined, and specifically for kids, is yet to be determined whether they're getting sicker. You're seeing more sick kids, but the degree of their sickness, it doesn't look like they're, so, if you got thousands of kids now who are catching COVID and we didn't have that, you're going to have a lot more kids in the hospital, just the numbers that we've seen in the adults. And hopefully we're not going to see a huge uptick in kids dying, but it does happen. And I think every community is getting to that point where if they don't have a kid that died in their community, they know of a kid that died, in a community near them. And that's too much. That's too much. We just can't get used to kids dying, especially from something like COVID, with some things that we can do to prevent it.
So I did to know my wife, she's a medical assistant, so she brings numbers home every day. So I was looking the other day, and it was saying like, this Mississippi is about 400,000 cases, and we're almost at 8,000 deaths related to COVID. Is that somewhat accurate? Would you say that's somewhat accurate, or?
I think it's an undercount.
It's undercount.
Yeah, I think especially now, I think it's an undercount on the number of cases. Certain places there may be a lag, and I can imagine. I can't imagine doing all the stuff I need to report to the state when I'm seeing 80 to 100 patients myself in a day. I'm not doing that. It's not that bad for me. But I think that it's an undercount. I think that there's a lot of people, and I know folks that are testing, doing the home test and testing positive, and no reason for them to say anything about it, and they don't. I know of parents who test kids, like home test, and they test positive but potentially send them back to school. I know schools that potentially don't do anything about other kids who've been contacted. And so I think it's an undercount. And I want people to recognize, because you got those people who are just anti, fill in the blank, anti everything. And some are going to say everything ain't COVID. And you asked me early on, were we in a once in a generation pandemic? And the answer is yes. And so COVID isn't the only thing killing people in our community. COVID is so disruptive that it's made more people die from heart disease and strokes. More people die from preventing stuff. People are dying from cancer. And so if you look at the excess number of deaths, and so we know in public health and stats that deaths can be pretty stable. And what I mean is, if you look at the deaths, and they record deaths in the state of Mississippi. So if you look at the deaths every year for all causes, 2017, 2018, 2016, 2015, they hovered around the same number. When you look at the deaths from 2020, there were excess deaths in every category. So there was more people dead from heart disease, stroke, cancer, fill in the blank, than could be predicted from the previous years. Those previous years were pretty stable. 2018 looked about like 2017. 2016 looked about like 2015. But when you look at 2020, it was so many more deaths. And so think about what happens when you got a hospital full of folks. You got people with chest pain right now who are actually having a heart attack, but don't feel like going through the trouble of going to the hospital. So they die. You got people who are in huge car accidents that can't get airlifted to the med because there's no room in the med. And those people potentially die. And so this past Friday, I was in Marks, Mississippi, which is in the Delta. And the coroner, that's the person who comes and, when people die outside the hospital, they come investigate, report. And I was just asking her, have you seen a lot of deaths? And she's like, yeah, we see a lot of people dying at home. And I was like, do you know the reason? Well, we try our best. We go in and we try to figure out the cause and things like that. And she was like, we're in a place where we don't have a lot of hospitals. And so we already have a lot of people dying at home. But there's a whole lot more folks that's just dying at home. And I think every community can kind of see that there's folks that, that went to sleep and didn't wake up. And we've heard about this. And I'll tell you about my patients. I've not lost as many patients in this last 18 months. So I've lost more patients in my last 18 months than I have in the previous 6.5 years combined. So it's more than just COVID. It's COVID and the COVID-related disruptions, which is why I personally, and why others in healthcare, just want it to be all over. But we want it, we want folks to kind of do what they can, get the vaccine, protect themselves, so that we can get back to something that looks a little bit more like normal. Because we're not in normal times now. My fear when I go to work tomorrow is that I'm going to have people who are sick and need to be in the hospital, and I don't have a place for them to go.
Wow. Well, the numbers they going up. That's why I say I think a lot of people don't understand. I tried to read articles. When they read them, they said they took the vaccine but still passed away. But what does the underline say above the headline? What underlying health conditions did they have when they got the COVID?
And that number and that number is small. So I that number is really small. So when you looked at the numbers and investigate the numbers, 90 90+% of those who are dying have not been vaccinated. And that's true across the state. That's true across our health system, where the number is even higher, that of all the folks who died in the last 6 weeks in our health system, none of those people were vaccinated. And so, it's a little tough that from a news standpoint, any death from COVID, especially a vaccinated death, is newsworthy, but it may not represent the actual numbers. And what we're seeing is that being vaccinated is a significant protection from dying. So that's why we're really pushing folks to get vaccinated so that they can survive COVID. We're trying to get people to survive COVID.
So if you already had COVID and recovered from it, do you think that person should still get vaccinated?
I recommend it. And the reason I recommend it is because with this Delta variant, a prior infection isn't seeming to protect folks from catching the Delta variant again. And there are studies to show that although natural immunity does give you some protection, the natural immunity seems to disappear faster than vaccine immunity. And so we recommend, those people who had COVID and get vaccinated, it's like those people have gotten 3 doses of COVID. They've gotten 3 doses of, 3 doses of their immune system being exposed to some part of COVID. And those people are potentially, much, much, much more protected. And, it's hard to tease out that number, but I wonder if people who are fully vaccinated after a prior COVID infection, I do wonder if they have even more antibodies than I have. Since I hadn't had COVID, I've just been vaccinated. I wonder if their antibody response is a whole lot more robust than those who just been vaccinated. But I do recommend that people get, even if you have had COVID, get the vaccine, because the vaccine immunity is more predictable. And what that means is we have a general expectation of how long that lasts. I know that we're in the where we're still learning, and we're still, even 18 months now, we're learning in real time. And it's not something that's easy for the public to see, but it's something that, we're fairly used to in the health community, where we learn something in real time.
Wow. So let me ask you, how long does the protection, is it a certain length of time that the vaccine cover you, protect you from COVID? If you get the vaccine, how long does it protect you?
That's a good question. We know that at least 6 to 8 months. I think it may be longer. And right now, like I said, we're learning in real time. So right now, in the last couple of weeks, you may have heard, okay, we recommend this group of people getting fourth. I'm jumping the gun. This group of people getting a 3rd dose of vaccine. Those are people with moderate to severe immunosuppression. So if you had a kidney transplant, liver transplant, heart transplant, if you are getting therapy for your cancer right now, if you're on certain kinds of medicines, then you need a 3rd dose of the Pfizer or Moderna. Now, for the general population, it's interesting, because if you look at just measuring antibody levels, it looks like those levels decrease after a period of time. And so it may be 8 months. But what I'll tell you, though, is antibodies are but one component of our immune system. We have other components. And so a pure measure of just the antibodies may not truly reflect the full immunity to the virus. That there are some parts that are harder to measure. So we know that it's getting 8 months or more. It may be even longer. We don't know yet if this is going to be a yearly kind of shot. Other coronaviruses don't. Our past experience with other coronaviruses, so the common cold and the things like that, they show that they don't mutate as fast as something like the flu. And the reason we get a flu shot is the flu mutates so fast that a different variety of it spins up during the season. And so we get a different look to the flu. The flu can change its look a little bit, and that can go toward why we need a different flu shot. With COVID, we may not need as much as we need as a flu shot. So we may not get to that point where we have to have a year-on-year COVID. But again, we're learning this in real time. Now, while learning this, I'm fully confident in telling people that vaccines are really good, are a really good thing to do. And even if the immunity decreases, we haven't seen where, at least those antibody studies, where it looks like their immunity goes to zero. So it doesn't look like they go down to an unvaccinated type status. And so I anticipate in the next few months or even longer, we'll have a better explanation or a better answer for how long does it last.
Okay. So with the kids, you answered this. So with the kids in school, I know my daughter and them, they told me, I didn't know this, and Keywan spoke on it also, that the kids are interacting more. They're interacting more with each other now in school. So do you think they need to go back to where, when they first went back to school, where they are masking everyone, no changing classes, eating lunches in their classroom with one another? I know a lot of schools are changing class, going from class to class, to where there are multiple people in that environment, so they're interchanging with each other. Do you think they need to go back to like the first beginning when they let the kids go back to school when COVID first broke out?
Yeah, I think if we can recreate as much of what made us successful last year, I think we've shown. And in Mississippi, we weren't clear. So last year, when school was about to start, we weren't sure whether it was going to work, but we did learn that it did work. We did learn that with those measures that we were able to keep kids in school, and in-school transmission, and for those parents whose kids still got it or were contact traced, actual in-school transmission was really, really low. And we found that kids caught COVID at family events. They caught it at sports practice. They caught it at those things outside of school. So there's no denying that in-person school is the best kind for kids. And so if we can just do what we did last year, and what frustrates me is all we have to do is do what we did last year. There was no problem. Kids did fine. There was no new conditions. There was no new conditions that kind of came up, and we just ended up, and so it's crazy that you got folks, and I'm gonna speak directly to them. You got folks that don't have any skin in the game, and I'm talking to all those folks that don't have kids in school districts, coming in arguing that masks are harmful for other people's kids. Where are your kids? So, and it makes me angry that they're jeopardizing the health of other people's kids for some political agenda. And so, it angers me that we are having this debate with our kids' lives at stake. It's our kids in the schools, and you got folks that don't have any of the training, who are, or if they do have the training, aren't experts. They just want to find their moment. And so we know what works in school. We know that in-person school is good. We know that we've done it. And so it's just insane to me that we are trying to reprove the point. So every school that starts mask optional, how many schools need to switch to virtual for them to realize that you need to kind of start with the mitigation strategy? There's just so much virus in the community that if, the only way that the virus, you're not seeing your numbers go up is if you're not measuring them and if you're not reporting them. And many schools are not measuring and not reporting. And so, a long answer for, yes, we can go back to a safe way of doing school. Even if we have more kids in school, I think that we can safely take care of the kids that we have in school, even though it's more kids now in person than we're virtual. But I think that we also know how to safely do it. And that's not even controversial. So, I want folks to realize that, not buy into all this crap, these folks that's kind of spewing out garbage at school board meetings. They're not even part of the debate. When you think of, if your child is sick, you're going to come see us as a pediatrician. We don't debate whether masks work or not. We know that they do, because our everyday life knows that they work. We see people with COVID, and all we had to protect ourselves was our mask and their mask, and we didn't catch it. And we stayed able to see people with our mask on and things like that. And so, if you want to debate whether masks work, you probably don't even want to hear what we have to say. And so I'm learning not to waste my time in those kind of debates, but back to, what, you were saying about, can we safely go back to school? The answer is yes. We just need to do what works. And the hard part about it is, in Mississippi, we showed the rest of the country what works. And so there were research and data and studies out of Mississippi looking at our experiences with going back to school to show that in a place with appropriate measures in place, the transmission in school was really, really low. And now to have leaders acting as if our experience didn't mean anything, and as if that's up for the debate. And that's, it's a shame. Shame on them.
Well, yeah, I think the same also. My kids, I let them go back when they the second half of the year, and it was some things put in place that I agree with. Those interchanging with classes, bringing the food to the classroom, not going to the cafeteria. So my thing is now, why can't you do the same thing that you was doing before until we get this under control and understand that our kids, like, now that would make me angry also, that a lot of kids, like, I'm not so much worried about adults. Adults should know what to do and what not to do. But our kids are at a stage where they don't know what to do. They come figure they're going off of our instincts and what we're telling them to do. So as adults, we are putting them in a bad situation. And then I go to school sometimes, you have teachers without masks. You have teachers that interacting with our kids without masks. And you don't know if they vaccinated or they're unvaccinated. But I know you still can catch it. But we're trusting you with our kids. And we're trusting you to do the right thing with our kids. But it's to the point like, well, it doesn't matter. We don't have a mask ordinance, so we don't have nothing in place. So we do what we want to do. So it's up to you to send them to school. And you see have people that, like you say, I've seen kids, they'll send their kids, they know their kids sick. And will drop them off at the school to pass something along.
I mean, and that's, and so importantly, what I recommend, if your kid is sick, keep them home. Keep them home, please. Don't send your kid to school sick. It could save somebody's life. I mean, and that's the thing about COVID is, a lot of people are just kind of making this an individual freedom kind of thing. COVID could care less about our individual freedom, and that pursuit, and that your freedom stops where my freedom starts. And so you have a freedom to not do the things, and I have a freedom to not catch COVID from you. And so we really have to be careful about, those kind of things, and really just hunker down and do the things that we know worked. It's about masks. It don't matter which, who the president is. We know those are the things that work, and we've learned it. We didn't know for sure that they were helpful in the beginning. We were trying to keep masks. You remember what happened to tissue? We were trying to keep doctors and nurses to have some masks. And then we learned that they really do make a difference. And now, like I say, with school, we know what has worked for us. And we really do need to kind of do those things. In addition to, for those who are eligible to be vaccinated, 12 and up, it can go a long way in keeping our kids into normal school. I feel sorry for those kids who play sports, and also plead with those who are coaches, set the example, help explain why it could help for your team to have as many of your eligible people vaccinated, so that you can have a season, a football season, a basketball season. Otherwise, you're going to forfeit. I'd hate to see what the playoffs look like. Right now, South Panola is virtual. And what that means is there's no football. There's schools around here that are virtual. That means no football. So we're going to miss a whole lot of Friday night football just because COVID is spreading through schools, and it's an opportunity for coaches to lead the team. Coaches and athletes play a really important role in schools, and they can be the leaders, and they can help some of the other teachers and students. They can help set the tone. We know the vaccines work. And, just to put it simply, my son's not old enough for the vaccine, but as soon as he gets old enough, he's getting it, whether he wants it or not, because that's my job as his father. My job is to make sure that I'm protecting him till he can get to the point where he does it on his own, till he gets to the point where he's able to balance those things, and even to a point where he may not want it. It's a shot. He might not want it, but I know the importance and the risk that we're dealing with.
Yeah, I think I'm going to have one more question for you. I don't want to keep you too long. So somebody asked me this, so I'm going to ask you this. What the COVID-19 antibody infusion, what type of treatment is this?
Yes. Thank you. Whoever asked you that. Thank you. My wife sent me a text message saying, tell them about the antibody infusion. So the antibody infusion is just that. So it's antibodies that are already specific for COVID. And what it does is, instead of making your own body produce the antibodies, so the time for your body to do it, we know that when you give those antibodies to people early in their COVID course, so within the first 7 to 10 days, we know that can save people from getting so sick that they need to be in a hospital, and can save people from dying. So, I've heard it said plan A is to get vaccinated. Plan B is, if you have COVID symptoms, get tested, and then get someone to write the monoclonal antibody infusion, especially if you're high risk. And so if you're in Mississippi, the chances of you being high risk is really high, because overweight and obesity is a risk factor. So if you're overweight, no matter how active you are, if your BMI is 25.0001, you meet criteria. If you have high blood pressure, if you're older than 60, heart disease, diabetes, kidney disease, pregnancy, sickle cell, if you have those risk factors and you have COVID and you're early in your course, you need to get the monoclonal antibody infusion. It will save your life. Horse pills won't save you. So if you, and it's really important to know, as Black folks, we need to know what we need to advocate for. So if you don't have a relationship with a doctor or a nurse practitioner, and you just go to urgent care, or just go to the sick clinics, or you just go to the ERs, you need to know that if you have those risk factors and you have COVID, you need to advocate, which means asking for, okay, I got COVID now, and my BMI is 39. Are you going to order the antibody infusion? You need to know so you can ask for it. And if they don't do it, you need to find somebody to do it. And that can be the difference between catching COVID, ending up in the hospital, catching COVID and dying. And we still don't have as many Black people getting these antibody infusions as they're getting COVID. And so I always worry if it's just not being offered. So I'm telling everybody, if you have meet those criteria, and if you're younger and have some of those conditions, you may be eligible for the antibody infusion too. So I'm talking about 13, 14, 15. You'll need your pediatrician to kind of, help guide that decision. But that monoclonal antibody infusion is another way of getting some protective antibodies to save you from getting really, really sick from COVID. It's not a vaccine, because your body didn't generate the antibodies itself. So so if you can imagine somebody who's hungry, and you give that person food, that's the monoclonal antibodies. You're giving them food, they're hungry. Now, you also imagine another person, they're hungry, but you teach them how to cook. That's what vaccines do. And so, both are necessary. I mean, if I'm really, really hungry, I'm going to be mad at you if you're trying to teach me to cook. But it's going to be so much better for me in the long run. Monoclonal antibodies is a short-term good thing to get your body protected so that you don't get sick. So I repeat, if you have any symptom that could be COVID, your nose stopped up, you sneezing more than normal, your nose is running, your sore throat, you got a fever, you're achy, you got a headache, you just don't feel good, get tested. If you test positive, ask for the monoclonal antibody. They can be given as an infusion, and that's an IV drip. They can be given as an IV drip over an hour, or they can give you 4 shots. So kind of 4 shots, what we call subcutaneously. And that can protect you from dying, can protect you from being in a hospital. So ask about it. You're probably not hearing a lot about it, but I'm telling you that if you got COVID, you know somebody who meet criteria who got COVID, if they walked out with anything other than a slip telling them where to go get the monoclonal antibody, they're not treated well. We can talk about COVID therapies and stuff like that. Hydroxychloroquine, we found that doesn't work. Ivermectin, it doesn't look like it works. So don't go to the feed store and get horse and cow medicines. It's going to kill you. The monoclonal antibodies can save your life if you have COVID. So, whoever brought that question up, I appreciated it, but we really do need to talk about monoclonal antibodies and have this conversation over and over and over again, because it's another therapy that's out there and it can potentially help us get out the crisis we're in right now faster.
Okay. Yeah, it was my first time when they asked me about it and told me to ask you. Well, actually, my auntie, she asked about it, but that was my first time hearing about it. She said she wanted a question she wanted to ask. That was my first time hearing about it. You explaining it. So you saying that if you have it and you leave the hospital, you need to ask about getting it.
Yes, you need to ask about getting it, especially if you meet that criteria. And like I say, it's easy to meet the criteria. In Mississippi, the vast majority of us, we weigh more than normal, and that's all it takes. That's all it takes. You don't have to be on pills for anything. If again, what we're trying to do is make sure we save as many lives as possible. So that means we need to deploy this therapy just as much as, and it's, the supply, we got the supply in the state. We just need folks to be referred for it. So the people diagnosing COVID need to refer people for the monoclonal antibodies.
Oh, okay. So yeah, she asked me, and I never heard of it. And I was like, "Where?" I didn't ask. I said, "Well, let Vernon explain and tell us what it's all about."
Yeah. We need to talk. I'm used to talking about the vaccine and the vaccine and the measures, but the monoclonal antibodies is another important point for our community. And so, as more questions come up, you'll get them to me. If questions come up from this, you shoot it to me. And if there's a lot of questions, I'm willing to come back on.
Okay. So I know this, I'm gonna try to end it and go from here. So I'm gonna ask you this. So I heard you mention the key word. I heard obesity,
Yep.
Heart failure, heart disease, cancer, yep, and all this. So if you have these symptoms, you have these conditions already. If COVID attack your body, will it be worse on you than a regular person that's just getting COVID? Okay.
Yeah. And so we have a good sense of what conditions can lead to a bad outcome with COVID: diabetes, obesity, high blood pressure, heart disease, lung disease, people who are actively have cancer. And so these are the conditions to, here's the thing about those conditions. Many of these conditions are long-standing conditions. Many of these conditions are definitely related to what you eat, how you move, and all those things. many of those conditions can be improved by moving more, watching what goes in, controlling what goes in. But those things are going to happen over the long period of time. And so if you got those conditions, one thing that you need to know is I'm at high risk. You need to carry that around in your mind all the time, so that means you think differently when you're exposed to folks. You think differently when you're trying to plan that, the party kind of thing. Hey, I'm at high risk. If I catch COVID, I'm at high risk for getting real sick. You need to think about that, so that may push you to say, well, I've been thinking about the vaccine and I'm high risk too. No, that's enough for me to get the vaccine because I'm high risk. And then the last thing is, okay, I got COVID now. I'm high risk. I want the monoclonal antibody. And you keep finding somebody, you keep asking until, and the thing about it is you got to get it early. So it works the best if given within 7 to 10 days. So that means that as soon as you feel different, get tested, so that it's okay if you have to wait 2 or 3 days to get the monoclonal antibody. I mean, some of my patients have had to drive, they've had to drive. And so I'm in Tupelo. I don't know if you're not familiar with Northeast Mississippi. I've had folks having to drive to Aberdeen up to Iuka, in kind of extreme Northeast Mississippi, just for the monoclonal antibody infusion. That they the timing for them to get in at Tupelo was going to be too long, and they had to go different places. And so, I imagine if you're in the, Marshall County, DeSoto County, Memphis area, your options may be a lot. You may have a lot more options in a smaller kind of geographic place than where we are here. But really important that you get diagnosed early, and then you get those monoclonal antibodies. And again, if they don't offer it to you, ask about it. And if they don't, and if you ask about it and they don't offer it to you, don't go back. Don't go back. Right, because that's not a place that's leveraging the best research or the best evidence right now. So we're all learning, but it's something that is not that controversial, like the monoclonal antibodies. We know that they really do make a difference. Some of the other things that I've had my patients go home with a prescription for, those things are really controversial and borderline dangerous for many of those things. And like I say, I hate that I have to say it, but I'm putting it out there. Do not go to the feed store or the agriculture store and buy any kind of animal antibiotics or animal medications to take for COVID. Don't do it.
So that was my first time. So you have patients, people that are actually going to the feed store to take.
Yep. Some of these medicines, one medicine is used for parasites. So if you got dogs, it's one of those medicines to kind of to fight heartworms. And so you can get it for dogs for heartworms. You can get it for cows and horses for same thing, for parasites and heartworms. And some people who been led to believe that this is going to make a difference for them don't want to take a vaccine, but will go to a feed store and take some of this medicine. And the problem is that the dose for a horse is much, much higher than the dose for a human. And so there's been more calls to poison control for people who've kind of overdosed on this medicine. And one is it's called ivermectin. Ivermectin is the medicine, and it's one that early on we thought that it made a difference, but then as time has gone by, we learned that it didn't make a difference. And so, but it became kind of catchy from a political standpoint. And so, people kind of hung on to it like people hung on to that hydroxychloroquine because it had a political angle. Their news station told them that could help with COVID, and the politicians told them. And again, it's garbage. So message me on Facebook if somebody give you a prescription. It's just message me on Facebook. And again, message me on Facebook if you got COVID and you in that category, and we need to figure out where you can go to get that monoclonal antibody.
So I'm not gonna keep you any longer. It was great having you on here for this insight. For like you said, you willing to come back home. I know you got. I know it's been hard in the medical field for a lot of you doctors. Y'all trying to keep us safe, keep us up to date on what's going on, man. I really, man, my frat brother, my classmate, I really appreciate this opportunity that you came on to share with the community. And like he said, hey, y'all message him if y'all need some more insight on what's going on in the community, what you can do to protect yourself, protect your family, protect your kids. Please protect your kids. Vernon, we appreciate it. I want you to wrap it up with, if anything you could say to the community to help us keep each other safe, keep our family safe, what would you tell us?
Yeah. One, it is not really about you, it's about us together. And we need each other to get through this. And so we're going to need to do those necessary things, even if it means we're a little uncomfortable for a little longer. Hold on. The best way that you can show that you care about somebody is to kind of, help protect them. What that means is, getting vaccinated if you're eligible. Those vaccines work and they are safe. Keeping distance, wearing a mask. You're probably not going to need to wear a mask forever, but we need to wear the mask right now. And just kind of, making sure that, we are taking care of our community, which includes our kids, like we try to individually take care of ourselves. And that means really, really understanding that it's about us, that, our kids, particularly our future. And there's a lot of stuff that we've learned from COVID. I encourage everybody to use what we've learned to put it into action. And then the last thing that I'll put in is be careful about the stuff that you're consuming on Facebook. So we know that food and other stuff that's harmful to us can kind of be harmful for our body, but be careful about what you're consuming in your mind. Be careful about passing those videos with some disgruntled person who have credentials, but they're talking about stuff that will put your life in danger. So all this conspiracy, fear-mongering kind of junk, control that, once that stuff get in your mind, that may create some doubts, and that doubt may make you make a decision that can be harmful for you, and you may have a consequence that you can't undo. So when COVID comes home and takes away someone that you really loves, you can't get that person back. And so a simple thing as in, so I encourage you, if someone's still trying to debate about masking and stuff like that, you got to ask yourself, what are they trying to get me to do? And we got to be really careful of folks who are trying to sow doubt, but they do it from a position of privilege and protection. And so those folks are protected from the consequences. You're not. And so you're going to have the consequences. Your family, our community will have the consequence. And these people will go on the show tomorrow to continue to sow doubt. And, and so be really careful about the stuff that you consume in terms of the media and things like that. And remember, before COVID, when something happened to you around health, you came to us. And after COVID, when something happens to you around health, you're going to come to us. You don't go to CNN, you don't go to Fox News, you come to us. So what I want you to do is to trust us in healthcare. The nurses in the community, physicians in the community, nurse practitioners, you've trusted us so far. We hope that we didn't disappoint you, but don't let, talking heads and news tell you that we somehow are complicit in some big conspiracy. And so, this good information is power. Bad information is detrimental and actually deadly. And so, I anticipate I will need to come back on. I anticipate I will need to come back on because in my mind, I just remember all of the stuff I wanted to tell you. I got the important stuff out, but there's just so much more. And I think in the next couple of weeks, there'll be another question about who gets boosters? How do you get a booster? And then another question about where are we now? Right now, it doesn't look like things are getting any better. It looks like they're getting worse. And so we hope that we can kind of go ahead and peak so that we can start getting better, but it doesn't look like that. I think the virus has found a great way to transmit in a divided community. And so, hang in there. We can get through it. We learned a lot. We got a lot more tools, and we can get through it.
Hey, yeah. Hey, I think so too. I'm gonna have to get you back on. So if you're willing to come back on, I know that booster. I remember seeing the booster earlier today.
Yep.
People starting to take it, so you can identify and tell us what the booster is about and what it's going to do to help the community and help everybody. But
Yep.
I really do. I really appreciate you sharing these facts with us, and nothing nonfiction to come back to the community. I try to get back with the community with different people to share
Yeah.
experience and knowledge of what's going on. But Vernon, I appreciate you, my classmate, my brother, my friend brother. What do you say? What would you say back in the day? Go Mob.
Go Mob. That's right.
And I appreciate you for to keep inciting the community and helping in the health field and helping us get back to some sense of normal. I really appreciate you, man. And hey, I want to get you back on again. I appreciate you, my brothers, for coming on Dole's Road Talk and speaking with us on this health issue. And hey, you have a good night. Protect your family and your kids, man.
You too. Take care, man.
Appreciate it. Much love. All right.